Well, it started when I was young. I was sick. I had a complication of strep throat that we don't see today, and it went through my neighborhood. And so as a result, I had problems until I was about 20 years old. So I had this early interest in medicine. But then as I got to college age, I realized I didn't want to go to college for 4 years of college and then 4 years of medical school. So I went to pharmacy school first. And I thought maybe that would satisfy my interest in medicine. But pharmacy school didn't do it for me. And so I worked as a pharmacist while I went to medical school. In medical school, I had initially a strong interest in fields that used a lot of drugs because of my pharmacy background. But then I became very interested in surgery. And like many students and medical students and residents, you find a mentor who makes something so dynamic that why would you do anything else? That initial mentor was Dan Bursick, a neurosurgeon in Pittsburgh, who showed me how exciting this was. And then during my residency, Henry Brem was my mentor who showed me not only was brain surgery exciting, but brain tumors was the most dynamic and interesting part of neurosurgery there could be. And that's how I ended up in brain tumors, because I had mentors that directed me and showed me how exciting this field is and how much you can help people, that why would I do anything else? Well, the most rewarding part about being a doctor is that you're injected into a person's life at a moment of maximum stress. For me personally, my practice in brain tumors, I meet people probably at their worst moments. I'm never the doctor you ever want to have to meet. You want to meet pediatricians and obstetricians, but not brain tumor experts. And so guiding them through the process, and then the privilege of being able to operate on them, on their brain, the fact that they would trust me to open their head and touch their brain and take this tumor out and minimize any damage or trauma, have them come out of surgery, as I tell them, with a bad haircut, just like you are now. That is the sole goal. And of course, it doesn't always work out that way, but you have to be able to deal with those situations too. But it's being able to care for someone and get them through a difficult period to take care of their brain tumor and hopefully cure it if possible and get them back to a normal life. How can they help other patients? Because it's a very stressful time. Brain tumors pop up like heart attacks, and the patients do not have a good understanding of what's going on, that is the newly diagnosed patients. And so all of a sudden 1,000 things go through their mind. And if they had a resource that we could direct them to other patients that would be willing to talk to them and guide them through the system, to show them that this is not a diagnosis of death, that maybe their life will be changed, maybe significantly, but they will still live and go on and be productive. And in most cases, hopefully their life will go on and this will just be a bump in the road for them. But they don't have to go out and sell their business. They don't have to buy a hospital bed right off the bat. They don't have to do all these crazy things, which I've seen patients do. I'm Dr. Kevin Judy, and my mission at Jefferson is to improve lives.